watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. He is Arizona's go-to implant dentist, Dr. Nate Farley. Dr. Farley, welcome back to the program.
Thanks for having me.
Now, you brought a stack of photos, so we'll try to get to as many of those as possible. Now, we should also mention, because we're talking about dental implant dentistry, that everything, pretty much everything we talk about today, you teach other dentists. You have a training center. Tell me about that.
So a while ago, we set out with a goal to try and figure out how to be more efficient with what we're doing. And we found the answer in a lot of the digital workflows on the market. And those,
what does that mean, digital workflow?
Digital means that back in the day when you went to the dentist and you needed something done, you would have impression material, which is very goopy, sometimes goes down your throat, put in your mouth. And that's how we would capture your anatomy to make something.
Okay.
Well, in the digital space, that goes away. And now you're able... Well, you've got scanners. They have scanners that...
Like cameras that take pictures?
Yeah.
Okay.
Small camera on the end of a wand that can take thousands of photos and turn it into a 3D image. So right there, while you're watching, creates the 3D image. And then they even nowadays have very accurate cameras that can take a picture from outside the mouth of the implant positions, so that you can have that accuracy and speed and efficiency. It's wonderful.
And this is what you teach other dentists.
Yes.
You call it like a digital workflow.
Yep.
Now, your office, we should also mention, and correct me if I'm wrong, how dental implants are typically done is you go to one doctor that does the surgery, you go to another doctor that puts the teeth on top, and these doctors send it out to some lab. At your office, you do both parts, and you have your own lab where you make the teeth right there. Is that why you do it so quickly?
Yes. And what you said is right. When I was in school over a decade ago, that's what we were taught to do, is to break it up into parts, spread it out over as long as you want.
It's still being done that way.
Oh, yeah.
Is that
most of the time. Most of the time, people still do it that way. And that's what I'm talking about.
Okay.
We were on a mission over 10 years ago. How can we get away from this? How can we make it less visits? And we started doing that and got it down to less, but new technology has come out since, and now it's down to 3 visits. And it's fantastic. And not
you could take somebody with no teeth, and in 3 appointments, they could have their upper and lower teeth that don't come out.
Technically 2 appointments. Because I'm counting the initial consultation as one of those visits. Because that first visit is where we basically digitize you. We get photos, we get these digital impressions. We know how you are now, but we also talk at that visit about what needs to change. You know, what do you want to change? What do I think that needs to change? And then you go home and we work on designing your teeth. We design your teeth. Off of that, we design where the implants should go. Off of that, we design surgical guides.
All done on a computer.
All of that is on the computer. So when you come in for that second appointment.
So what's changed? Look, you were on the program, I think 4 or 5 years ago.
Correct.
How is it better now for the patient than it was back then?
Yeah. I mean, as you know, things get better, and a lot has changed since then. We're now able to do things faster and more predictably and more accurate. And so what used to take a few appointments is now down to 2.
Okay.
The biggest change, though, for me is my appreciation for what it is we're doing for people, because we've been taking people who are struggling, unable to eat, sometimes in pain, and give them new teeth. It solves all of those problems that they came with. They can now eat the things that they want.
Okay.
Yeah.
And what do they like more? The way it looks or what they could eat? Or is it a combination of both?
I would say it's probably a pretty good combination of both.
Combination of both. How old can you be to do this? Like, what's your oldest patient?
That's had implants. We have had patients in their mid-90s.
Really?
I mean, I can think of a guy that he is still at his age. He likes to go dancing. He likes to live his life, and he doesn't care that he's in his 90s. He's going to get those implants.
So what did you do for him?
We took out the failing teeth and gave him new teeth.
Is that right? And he can eat whatever he wants?
Oh, yeah.
And they don't come out?
No.
So it's not like a snap in, snap out?
We're talking teeth that are placed and they're fixed. They're permanent.
So when you get like a 70-year-old in your office that says, Doc, are you sure am I too old?
Right.
So that's not even close to too old.
Easy to say, no, you're not too old.
Okay, good. Now you brought some photos. What are we looking at
Yep.
over here?
So this is a patient of ours. She saw us many years ago, probably 10 years ago. And her situation, as you can see in the photo, is that she is missing some of her front teeth. Well, she's also missing some of the back teeth.
Okay.
She's losing teeth because she's lost control over the whole situation. Too much decay. Things are breaking off. She's frustrated. She's frustrated, yet she's young and trying to live her life, trying to date, trying to, get a job, figure out her career path. And so you take somebody like this and you can solve that problem.
Would she have ended up in a denture?
Definitely.
So she was headed for a denture.
Oh, yeah. Yeah. In a lot of offices, that's the solution that she would have been
So what'd you
provided
do?
with. So for her, we removed her failing teeth and
Okay.
then we cleaned up all the gums and we got her upper and lower teeth that don't come out.
This looks
They're
good.
permanent. Yeah. Take a look. And if you look at her, you can see she's a different person. You can see that personality coming out. And this is just one of the photos that she took. It was a fun set of photos to look at. We've got a picture just like that hanging on our wall.
Now she's a younger person.
Yeah.
We talked about this in the green room, that even though you can't prove this, it's possible that, do you believe that the trajectory of her life, that means where she ends up in 20, 30 years, is different because of her increased self-esteem, charisma, et cetera? Can you elaborate on that?
Yeah. Her and many others. There's a patient of ours that had a very similar situation. Young guy in his 30s, and yet his teeth were failing. Some of them were broken, some were loose. The decay you could see with your own eyes. I mean, it was a bad situation. And he's in his 30s, just like her. And when you take somebody like that and you just try to imagine, what is that going to be like trying to eat at a restaurant, dating, going for a job interview? When you take somebody and you can turn that around 180 degrees, you turn that around, it is going to change the trajectory of their life.
Wow,
they
okay.
are going to live a completely different life with those fixed teeth than if they had gone a different route like dentures.
Is this the future of dentistry, whether it's 20 years or 30 years from now, where dentures as we know them won't exist? They'll all be attached to something like implants?
I certainly am hoping. That is what I want. In our practice, we see all of our patients on somewhere along the journey. Everyone's going to get fixed teeth one day. That's what we believe. We're all going to get there.
When you say fixed teeth, you mean new teeth supported by dental implants?
Oh yeah, teeth that will not come out at night.
Okay.
Yeah.
Well, good for you. We have time for more patients. What else?
Okay. I want to talk a little bit more about Carol. Okay. So Carol is near and dear to my heart. Okay. I've brought a lot of photos today, and if anyone comes to our office, you're going to see these photos lining the hallways.
Is that right? Okay.
Carol, I put right next to my room because I want to see Carol's face every time I'm heading into a surgery, because Carol came to us with a long history. Okay. She lived a life where if there was a problem, it wasn't let's get a filling, it's let's get a tooth out. So she ends up at this age, she is missing a lot of teeth. She still has decay that she's battling, and she's frustrated. Okay. She is ready for something different. She doesn't really know what that something is, but she's ready for something different.
So were her teeth so bad that they probably had to have been taken all out?
Correct.
And she doesn't want a denture, obviously.
Correct.
Okay.
There was no options left to keep the teeth that she had. So they were removed and we cleaned everything up, and now she has upper and lower fixed teeth that will not come out. Now the thing, so that's the start of the story.
Okay.
The thing about Carol, and the reason she got by the door going into my operatory, is Carol, she's a changed person. I mean, immediately we get her in for a post-op, and there's something different about her. She's happier, she's more confident, she is exuding confidence, but we keep seeing her back. And so, because this was, years ago, and we see her twice a year at least for her cleanings. And as she comes back, every time she says, my life is completely different, and it's because of these.
She says that.
Yeah. And you can tell. I mean, she's lost 100 pounds. She's going to the gym. She's making better choices.
She tells you all this stuff.
Yeah. Yeah. I have to say this about Carol, or she will kill me if I don't mention it. First time I ever saw Carol for her consultation, She sits down and I can't do a New York accent, but she's from New York and her accent is awesome. But she sits down, she looks me in the eye and she says, I know everything about you except your blood type. She said that she researches better than the FBI, in her words.
Okay.
And so she took it to the internet and she researched in our area, who do I need to see to solve this problem? And I still, to this day, I don't know what it is she found out there about me, but she came 100% convinced that we're the ones who are supposed to help her.
So now she can eat whatever she wants.
And now she can eat whatever she wants. And she is she's a delight. She is happy. She's happy that she can eat, but happy about life. Happy, just feels like I don't know, just a different person. It's fun. So here's another patient, or I'll say patients. Okay, this is a couple, and their journey was a little bit unique. He's an engineer. Okay, and he came to us because his upper teeth were failing and he was going to end up in a denture, but he has family that has been in a denture. He knows what it's like and he didn't want to go down that road.
Okay.
And so he's looking for something different. Okay. So he starts off, we look over everything and he's willing to do this procedure, but just in the upper arch. Okay. He's still a little skeptical, doesn't know if it's really going to, promise, get the promised results. And so we do the arch and month goes by, suddenly his wife, who says, just watched him go through all of this, and her fears, because she also has teeth that are failing, but she has fears. She's scared about the sedation and what am I going to wake up? She watched her husband go through it and saw that, wait, that was not as bad as I would have thought it was. She figured it's her turn now. So she had the upper and the lower done. And now she's got both arches done. He only has the upper done. Well, the next thing is, of course, he's going, well, hey, now I got to do the lower arch. And so now we've got this picture I've got here hanging on our wall of the two of them, both with upper, lower teeth. They would have been in a denture otherwise. But now they can have all the food they want. They can really enjoy the retirement years. They can go to a restaurant, order anything off the menu and enjoy it. It's fun. It's fun. And one thing also, a side story about him, I already mentioned he's an engineer. And his whole career was around building precision parts for race cars. Okay. And so the thing that sold him to stick around our office a little longer to keep talking is we brought him through our lab. In our lab, we have mills, 5-axis mills.
And these are things that actually make the teeth.
Oh, yeah.
And print the teeth. Everything's like right there.
You can print teeth or you can mill teeth. Okay, 2 different options. And he's looking at this equipment and he's just blown away that this is happening in dentistry, because this is the equipment that he was using to make precision parts for race cars. And it's fun to talk to him. He even brought in some of those parts to show us.
You help me understand, because it's a loose term where doctors will say they have an in-house lab, and it may just be like a printer or something that prints temporary teeth.
Correct.
But you have a real lab. I guess dentists from all over the U.S. use your laboratory to make teeth.
Right.
Is that right?
Yep. So a lot of offices.
That's a savings for you since you own the lab.
Oh, obviously. It's huge. It's a game changer.
Because I know your prices. You're about 20% less than everybody.
Yeah. Yep, it's a game changer. It's a lot of people might say we have a lab in our office.
That's an unfair advantage.
When I say we have a lab in our office, I'm saying a completely different thing.
It's a completely business.
It's a whole different business. Now, in that business, one of the biggest clients is our practice and what we're doing. But we make teeth for people all across the country and a couple out of the country.
If something happens, or let's say you give them their new teeth and you don't like something, you could press a button and just make them another set.
Oh, yeah. Yeah. And what's different now than it was back when I was going through school is they can wear it home too. You can give them a set, they can wear it home. A week later, you give them a call. What do you think? And if they don't like it, I mean, heck, if they said over the phone, I wish the teeth were longer, we could lengthen them, say, all right, come in and just swap them out and they can wear those ones home. So they get to kind of test drive it. It's phenomenal. Back in the day, you couldn't do that because the teeth were in wax.
So is this all you do? You don't do regular dentistry like bridges and partials and root canals? And I mean, as far as you go, I mean, you're focused on just implant dentistry?
My focus is implant dentistry.
Now, you're a board certified prosthodontist.
Yes.
I did some chat GPTing on this and stuff, but I guess you're the prosthodontist is the one that kind of rebuilds these complicated problems.
Correct.
Is that right?
Yep.
I mean, you're like the specialist that fixes
full mouth,
like oral surgeons
full
send
mouth
people to you and all that.
rehabilitation.
To go to a specialist like you teach other dentists how to do this. Does it cost? It would seem like it costs more, but it doesn't. I guess because you have all the equipment right there.
Right.
Because people don't like going to the dentist, right?
Right.
They probably still don't like going to you. Do you ever hear that? Like, no offense, doctor?
Yeah. Oh, yeah. Yeah. Especially that
They
first
say
visit.
that?
At the first visit, yes. What's fun is that at the end of the journey, then they're sad when their last appointment's done. Because
Really?
Well, they've got a whole
like
team.
going, okay.
If you were to go to our Google reviews, we've got
A lot, yeah, I
a
did
good
see
number.
that.
If you read through our Google reviews, the one thing you're going to see over and over, people love our staff.
It sounds like a bit of an exaggeration when I was reading them.
Yeah, our
And,
staff
but
is
they liked it.
fantastic. Patients love coming to our office.
Good.
Yeah.
Good. Time for more photos.
Okay. So we met Mike because he was doing a little work on my partner's house. He's a handyman. Okay.
right.
And he's the father of 5 kids. And for his life, the focus was his kids to the detriment of his teeth. And as you can see in the photo, he hit a point, kind of that rock bottom where the decay got too bad, that front tooth broke off.
Now, can I ask you, because this decay, it's like a bacterial infection. You can't really brush it or floss it out.
Correct.
Is that correct?
Correct.
So it's
Decay-
not just because he neglected it. I mean, there's an infection.
Right.
Okay,
Right.
okay.
And the infection just got bigger and bigger and bigger till it gets to that point where you can no longer simply remove the decay.
Was he having a tough time eating?
Oh, yeah. Yeah. Limited eating. Can't eat the things that he wants to. Pain also. He has infection. And then in one day, we remove all of that.
Let's take a look
and
at
then
this.
he has teeth. And he's a completely
He's like
different
a model
person.
now instead of a
I know,
handyman.
I know. And the fun thing is now he's our practice's handyman. So he's the patient who's around our office more
He
than
has the
anybody
best
else.
teeth of any contractor, handyman,
That's
probably
right.
in Arizona.
Other than the next one I'm going to show
So these
you.
look like professional photos. I think you said that you can
Yeah.
like have a special day sometimes.
Yeah, about once a quarter. We'll get a bunch of patients who are finished with their treatment. We'll get them into the building, and we have a professional photographer. Got to take a bunch of fun photos, just like this. She's wonderful, and we'll give you the photos. You can do whatever you want with them, but this is the kind of stuff that we use to help other people to see what's possible.
It's very nice.
Yeah. Let me show you this next patient.
All right.
So I haven't mentioned this part yet
Okay.
about this journey that people are on and this particular frustration, but he specifically talked to us about how because of the decay in his mouth, because of the infection, because of the bad odor, he was having issues just wanting to kiss his wife. He was
Okay.
embarrassed. Okay. He was
wow.
embarrassed to have that kind of intimacy with his wife. And you take it away. The infection's gone. The frustration, the embarrassment, it's gone. And we got him upper, lower teeth that don't come out.
Look at this.
And the infection's gone. And you look at him, and he is now the kind of person who before you had to beg him to smile. And now
Even
he's,
at the dental office, they don't want to smile?
oh yeah.
They don't want to show their teeth?
Yeah, yeah. That first photo, that's us after saying, bigger, smile bigger. We got to see those teeth. But now he tells us he'll just look in the mirror and smile just to see his teeth.
He definitely is more handsome.
And he told us, and now he can kiss his wife.
But when people have these, severe decay
Yeah.
and they have bad gums, that's why they lost their teeth in the first place. Can you put implants in bad gums?
Yes.
Or can
yes.
how does that work?
The idea is that is removed at the time of surgery. I'm not putting an implant into an area that is infected. The infection's removed, and then it's
okay.
the healthy bone left behind that is holding that.
So the gums
implant.
get healthier.
Oh yeah,
And the gum
yeah.
bleeding and the bad breath, how soon does that go away?
immediately.
Oh, really?
Oh yeah, yeah. You see it. It's like there's the infection, and you take it out and you put it over here.
Do you ever read people wrong? Because like on this guy seems like just a cool guy to hang out with. But do you ever think a guy's like really serious or maybe a tough guy or whatever, And then once he gets his teeth, it's like you're going, I was wrong about this guy. Does that ever happen?
Oh yeah. One guy that comes to mind, a different patient, but he was a patient that every time we'd see him, we thought he was super serious, and it happened to be around COVID. And he wanted everybody to always wear a mask. If we walked in the room and we didn't have a mask, I mean, it was after COVID, but we're still around that time. He wanted everybody to wear a mask. We came to find out, it's because he was embarrassed and he wanted to wear his own mask because he was so embarrassed of his teeth, which had a significant amount of gum disease. The second we removed his teeth and gave him a new set of teeth, he stopped wearing the mask instantly. Completely different person. But he was serious, and then now he's just one of the most
So
happy
do they
people.
change, or they return to who they used to be, or who they really are?
I think it's the latter. I don't think they're changing. I think it's their personality that they're hiding because they don't want to draw attention to themselves. And so I think that when you remove that, and they don't see it as a barrier anymore,
Okay.
it's their own personality now coming out. I didn't change their personality. I just took away that thing that's making them not want people to look at them.
Now, back to the denture wearers, somebody currently wearing a denture.
Yeah.
And you and I have talked about this. You've helped me explain that it's tough to get the denture wearers who you could actually help the most because they don't go to the dentist very often, right? They don't even know their options. But what about if somebody's been wearing a denture like 20 years?
Right.
Isn't it true they don't have enough bone to do this?
It's only true that they might have less bone than somebody else. And that's a might still. Some people could be in a denture for many, many years and have plenty of bone. Now, let's say they have had a lot of bone loss. It doesn't mean that they can't have dental implants. There are many options for people.
How soon can they eat after it's done?
They can eat right away. And within a short period of time, they're eating whatever they want.
So at the beginning, take it easy, but
yeah,
then they could eat.
Yeah,
like
in the beginning, you're going to take it easy, but after you've gotten through this process, there are no limits to what you can eat.
So a steak or whatever.
Yeah.
Do you have
Nuts,
certain foods
candies,
that people
brittles.
like to tell you about that they're eating?
Yes. I can't say it's always the same thing. A lot of people say steak. I think this guy actually that we're just talking about, French toast with lots of syrup. Apparently it was something he struggled with before, but that's his thing. We have another patient, it was a pickle. That's what
they wanted.
And what did he do when he was done? He brought in a pickle to eat right there in front of us.
you.
Yeah. It's always something different.
Can you bite like a raw carrot with your front teeth, or you have to be careful with things like that? Or like bite into an apple or like corn?
At the end of this
doesn't matter.
procedure, yeah, anything. No limitation.
They could chew on ice?
Yeah.
I mean, you don't want them to chew on ice, but they could?
With natural teeth, I wouldn't. With what we make, I don't care if they chew on ice.
Really?
Yeah.
Okay. Time for a few more.
So this patient, we didn't have to find him. He found us, but in a different way.
Okay. How's that?
Well, it was our old office before we're in our current space, and we needed some counters. And that's his business. That's his trade. He does counters. He was doing our front desk, and at the time, our lobby had all these before and after photos, and that was enough for him. He knew he had a problem, as you see in that the before photo. He's missing a lot of teeth. He knows that he needs something done, and he saw all those before and afters, and he's the one who came to us and said, "I think I want to see you guys to get this looked at." And so he now has upper and lower fixed teeth on implants. Before, he had a tough time eating. He was very self-conscious about his teeth. He even told us that in his line of work, when he's right in front of the public. He's in sales.
It's in sales, yeah.
He is in a service type field where he's working with people, and he would have to talk in such a way that his lip wouldn't go up because he didn't want people to see what was hidden behind his lip. And so, but now, you look at him now, he's a completely different person. If you look at this before and this after, side by side, would you say that this one is more confident?
Yes, for sure.
Better looking?
Yes, that's for sure.
More ready to take on life?
And for people watching this, whether they're a denture wearer or they still have teeth, but they're bad, and the people with teeth, all their teeth have to be removed, what's the steps to getting to where they have upper and lower teeth that don't come out?
Great question. There's 3 steps to the process. First step is seeing us. Just get to the building, see us where we're going to take a look. We're going to give you these. We're going to lay out the options, kind of help you understand everything. And then the second step is a smile design appointment where you come in, we get some photos, some digital impressions. That way we can design your smile. Third step is you get your teeth.
Get your new teeth.
Yeah.
And then their whole life changes, you say.
And then the whole life changes.
And you say that
3
sometimes
visits.
they say, Doc, you changed my life.
Yeah.
You hear that a lot.
Yeah, we do. I would say that there's some truth to the way it's said, but I feel like we're not changing them. We're simply removing like this barrier that was keeping them from being them. You take away that embarrassment. You take away their not wanting to be themselves, and then suddenly they become that person that they already were. But it seems like magic, but it's fun to be a part of it still. I have to mention, we're not the ones changing their life. I mean, we're just solving this one piece, but they're the one who recognized that they needed something.
So they made
a phone call.
Okay.
They did their research. They called us. They said, I need something. And it's still, they might not know what exactly it is, but I need something. They came in. They decided to do this. And now we make it for them and we make it good, but still they're the ones that then go and start talking more and start smiling and laughing more. And we've had a lot of patients that tell us that they are starting to get a reputation around the office for being the jerk, the mad person all the time. This is when
they have their bad teeth.
Yes. Because they don't want to put themselves out there. And then you've changed this, you remove all that.
Now they're smiling.
Now they're smiling more, and they're seeing, and like I said, we didn't change their life, but their life is changing.
They did.
Because of their decision to do this. We're just lucky to be a part of it.
Okay, now Medicare, Medicaid doesn't cover this. Even the best dental insurance doesn't really pay for this. But you say people are financing this.
Yeah.
Like 80%.
Yep.
And not just your office, across the country.
Oh, yeah.
So
most people everywhere, that's how they do it.
Is that right? And you have to have okay credit, right?
Yeah.
To do this?
Yeah.
Do they accept co-signers? Things like this?
Oh, yeah.
So you have people in your office that kind of set it up for them?
Exactly. Yep. We work with third-party companies, and that's kind of what these companies do, is help people to finance these types of procedures.
Now, we're out of time. So final message, let's say the denture wearer, the person that their teeth are so bad, they're about to come out, they don't want a denture, they've heard what you have to say, maybe they've seen you on TV before, but for whatever reason they're skeptical, they're afraid. What do you say to them?
I guess my statement to that is, what's the harm in coming to see us? Come in and just see what the options are. Talk about it. Let us answer any questions that you have.
So if somebody wants to make an appointment, do you prefer they go to the website or just call your office?
Easiest would be to just call the office.
Okay, good. Well, I want to thank you for coming to the show. Good stuff.
Yeah, thanks.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.